Hello, and welcome to Dental Health Matters, brought to you by the BSDHT. Today, we're talking about something that underpins everything we do in clinic, our well-being. Dental hygienists and dental therapists juggle clinical pressure, emotional labour, and high expectations every day, and that can take a real toll over time. I'm Rhiannon Jones, President of the BSDHT, and today I'm joined by Dr. Mahrukh Khwaja, BDS, MAPP, positive psychologist and founder of Mind Ninja. Together, we'll explore the early signs of burnout, practical tools you can use during a busy working day, and how to build resilience in a way that's compassionate, not just about toughing it out. So, Dr. Mahrukh Khwaja, welcome to the Dental Health Matters, the podcast by the BSDHT. With a background in dentistry and a passion for evidence-based mental health strategies, Mahrukh has become a trusted voice in helping dental professionals protect their well-being and build sustainable habits for resilience. Mahrukh, thank you so much for being with us.
Thank you so much for this kind invitation.
You're a qualified dentist, but your journey has led you to positive psychology and founding Mind Ninja. What inspired that shift, and why do you think mental health support is so critical in dentistry right now?
Yeah, so great question. Just like a lot of us in the wellbeing space, it really started from my own experience of burnout and depression. So 3-4 years in after graduating, I was working in quite a difficult work environment, quite toxic, and I was going through some personal things as well. So it was a combination of the two that led me to experience this. And this was the first mental health challenge I would say that I had experienced. And so I was really at a loss as to how to navigate this time. I was constantly kind of ruminating about the past, and chewing over the past, as well as time traveling into the future, which felt very anxious. I was feeling like I wasn't able to be present, and I was really noticing a lack of meaning and purpose. And fortunately for me, I didn't actually feel the stigma that a lot of our healthcare professionals and dental professionals feel, in that I did seek support. So I actually contacted a therapist privately. So I didn't even go via the NHS route. It was more, I need something straight away, and I want to get help in terms of how to navigate this time so that I can get to a place where I'm kind of flourishing and feeling good again. That was the kind of goal. And so I learned all of these amazing psychological tools, through this, and I had this kind of textbook understanding because I had done a psychology BSc as part of my dental degree. Yet it isn't until, of course, you have this real experience where you're like, oh, okay, I get it, but I don't know how to use the tool. So, I was introduced to mindfulness, self-compassion practices. We explored cognitive behavioral therapy, all of these, very practical tools. And it really got me thinking after recovery that, look, prevention is so much better than cure. That's one of the pivotal aspects we learn in dentistry. Yeah, why don't we take that same approach to mental fitness, our own mental fitness? And so that led me on to kind of doing a deep dive into the research around psychological interventions for dental professionals. And I was really excited to see that, mindfulness-based interventions, positive psychology interventions, cognitive-based, self-compassion are really strife within healthcare professionals. We've got a lot of data, not so much on the dental just yet, but certainly medical and healthcare, there is data to support that these activities can help not only reduce things like burnout, but also can help, and equally as important, help increase happiness and life satisfaction and meaning and purpose, all of these really beautiful, positive wellbeing markers. And that led me to pivot into completing a master's in applied positive psychology, training as a mindfulness teacher, and then founding the business in 2019 to really bring those evidence-based things from therapy to us early on so that we can kind of flourish and perform at our best.
That's wonderful, and a great backstory as well. Thank you for sharing, because it's never easy, is it? But it makes it easier for other people sometimes to hear that. Okay, thank you. So many dental hygienists and dental therapists are balancing clinical pressure, perfectionism, and emotional demands from patients. What are some of the early warning signs of burnout or compassion fatigue that often go so unnoticed?
So, the way I like to think about burnout is really focusing on the psychological definition. So, if we look at Maslow's definition of burnout, there's three key characteristics. We've got increased emotional exhaustion. So, this is very deep emotional exhaustion where, the normal stresses that we have in life, we're finding really difficult to cope with. This can be as simple as, coping with emails and back and forth from patients, really stuff that we can handle feels so much harder. We're waking up and we're exhausted. It's not a matter of we'll go on holiday or feel better. It's just feeling very triggered from the morning throughout the day, essentially. So you've got the deep emotional exhaustion. You've got a lack of personal accomplishment. So really feeling like you're not really making a difference when it comes to your patient care. You're feeling like it's a bit pointless and helpless. So that's the kind of personal accomplishment aspect of that. You know what? My brain now is fogging on the third characteristic. How weird. Emotional exhaustion, personal accomplishment. Yes. The third aspect is deeply cynical thoughts around the workplace. So, feeling very critical about the work that you're doing. You might notice certain thoughts that are critical around being a hygienist, therapist, dental professional, not good enough, essentially. So, those are the three kind of key characteristics. When I like to think about then remembering the early signs of burnout, is thinking about the impact on how we think, we feel, and we act. So, as I was saying, in terms of thoughts, they're very critical, pessimistic, feeling and having this hopeless, helpless theme. And that's quite a key aspect. You've got that emotional exhaustion. So, in terms of your emotions, how you're feeling tired, depressed, low, sad. And then in terms of our actions, they're quite variable, but it could be that you're eating more or you're eating less, so your appetite could be impacted, you're sleeping more, sleeping less, you might be withdrawing from others or lashing out on others, and you also might be turning to unhelpful coping strategies such as drinking or drugs, or even kind of binge watching TV for hours when you get home and not having the motivation to perhaps do the things that normally bring you joy, like socializing, connecting with others.
That's interesting because I think I've noticed more perfectionism and more expectation from patients over, my own career. And I can only imagine how stressful that is for younger people with less experience, certainly. Thank you. So your work focuses obviously on science-based strategies from positive psychology, mindfulness, and acceptance and commitment therapy, also known as ACT. For those new to these ideas, where's a good place for them to start? I mean, could you share one or two simple tools that could perhaps help them through a busy day?
Yeah, absolutely. So I find that mindfulness and ACT it can be integrated in a beautiful way in the workplace. So often when we think about mindfulness, we think it means meditation, but actually mindfulness is paying attention to the present moment. And it does incorporate lots of other activities. So it could be, you simply, whilst you're delivering local anesthetic or waiting for the alginate to set or scaling or doing some sort of treatment, in that period, could you anchor to the breath and hone into your breath? We know from the science that actually, if we make that out breath slightly longer than the in breath, we're actually triggering the parasympathetic nervous system and we're inviting a host of positive emotions, a sense of kind of serenity, calm, focus, feeling refreshed. So some of this is around stress management, but not always. It could be just, you've got a really busy day. Sometimes we're double booked as well. And we want to feel refreshed and energized and restored again. And that's where we can take these mindful breaths. And it's just really thinking about what moments within treatment we can do this, what moments we can do this when, throughout the day. And it could be like when, before you bring the next patient in, maybe you take a check-in and ask yourself, how am I feeling? You could take a deep breath at that point and say, how am I feeling? How's my body feeling? How's my mind feeling? Do I need to support myself in some way? It might be that you need a water break, or you might just need to slow down for a moment. And I appreciate it can be very difficult managing our time as a clinician, but it's so crucial to feel restored before you bring your patient in and have that next interaction. So it's really thinking of how I can bake that into your clinical day. Now at lunchtime, is there an opportunity that you can go outdoors if weather permitting, if the weather is nice, and perhaps you do work close to a park. I've worked in practices where I've been close to parks, and I might take my lunch outdoors. Could you take a slow walk and notice, what can you see, hear, smell, really hone into your five senses and feel grounded? Is there an opportunity there? And that's you practicing mindfulness. So there's so many ways we can do this. And then even, starting from the beginning or the end of the day, when you're brushing your teeth for 2 minutes, could you hone into the sensation of the brush against your teeth, the different textures, the smells, the taste, really hone into that experience. Or whilst you're having a shower, really honing into the present moment. That's you exercising the mindfulness muscle. So that's a great way of introducing moments of peace and calm throughout the day, rather than perhaps leaving all of that to the end of the day, where if you've already got cortisol racing through your body, it's very difficult to undo that. And so I think that's where that could be quite helpful. And then in terms of positive psychology, one of the kind of key practices that I really love is the practice of gratitude. There's so much unrest in the world currently, and it can be, you can feel, real lack of optimism and hope. And that's where gratitude can be quite useful in terms of reminding ourselves that things are going well in our lives and things we can be grateful for. And we've got a lot of abundance, and that can really help broaden our emotions and broaden our perspective and make us feel more, hopeful in that process. So is there a way you can practice, especially in the workplace, in dentistry, where we are managing patients' expectations, difficult treatments, there's failures that happen in dentistry, that's very common, and part of it, patient complaints, all of these elements, it can be easy very much to focus on the negativity aspect, and our brain has been wired that way. So to buffer against that, honing into what's working well, and it could even be a practice you do with your nurse, or practice you do within the actual dental practice in terms of meeting. Could you incorporate that into a meeting setting where you go around each member of the team sharing wins of the day, small and big wins, compliments, treatments that have gone well, and that can be very uplifting, just listening to each other's gratitude points. And then I like to play gratitude ping pong personally when I get home. So you could write down and journal about gratitude. You could write down 3 things you're grateful for and why, which is a common practice that we suggest. But you can also, as with all these activities, make it your own. And so my version of this is gratitude ping pong, where me and my partner or like friends and family will go back and forth just sharing wins. And it's so joyful and also quite difficult at times, because you're really honing into those details, but it's such a joyful experience. So yeah, how can you incorporate increasing your positive emotions? And positive emotions aren't just about like feeling good, they do so much good. They build psychological resources, things like resilience. They're actually, they've got a scientific benefit, which is why we experience positive emotions. They broaden our perspective. And so, is there a way you can increase your diet of positive emotions? Sometimes as busy, productive, dental professionals that are focused on getting things done, we lean into goal setting and goals and deliverables. And sometimes we forget about the pleasure aspect. So how can we introduce a bit more joy into our day-to-day? So thinking about those activities as well could be quite interesting, embedding them into your week. Think about like what activities do bring you joy, and then how can you incorporate those more going forward, rather than perhaps leaving them to the weekend or holidays. Think about kind of crafting your life so that you can embed some of those. And we're not talking about, really big things. It's just those small moments of like savoring your cup of coffee, or going for that like slow walk outdoors, or reaching out for that favorite book.
Thank you so much. There were so many tips there, and I didn't realize how much of that I perhaps already do, even just picking a blackberry on my walk home from work and enjoying it. But then I was thinking, I think I probably do practice those, but do I help my team? Could I also share some of those tips with the nurses I work for? And gratitude is even just saying thank you to the person you've worked with all day and acknowledging how that day was so much better because of them being in it. So no, this is lovely, but not everyone feels positive all the time. So some really good tips in there. Thank you so much. So another question for you. You talk about building resilience in a way that's proactive, not reactive. How can we shift away from the idea that resilience is about sort of toughing it out and instead foster more of self-awareness and emotional agility?
I think it all comes from personally, what I think is if we lean into certain definitions of self compassion and resilience, then I think that helps unpack it. So for me, the bounce back analogy of resilience, it feels very outdated and has never resonated with me. But when I look at the research and I look at particularly Karen Reivich's work around resilience, and this is what I'm drawing upon when I'm thinking about resilience. I love the way she defines it. And she's done a lot of research in this space. She facilitates resilience training at schools, organizations, army, things like this. So her definition really of resilience is the ability to navigate adversities and challenges and grow through them. So you've got two aspects there. You've got this journey, this navigation aspect, and the growth aspect. So you come out of it having learnt these new, skills, and you're better for it. And then the last part of the definition is through using our internal psychological resources and our external psychological resources. So when we talk about internal resources, we're talking about our thinking flexibility, our self-awareness, so our ability to kind of check in and know what's going on, emotional regulation, so to down regulate when there are moments of stress, positive emotions. We're talking about our optimism levels, that can help as well. We're talking about our mindset. Is it growth orientated and compassionate? All of these factors are quite crucial. And then we've got the external aspect. So the external resources is, are you able, when things are going horribly wrong, are you able to go seek help? Whether that's from friends or loved ones, from societies, from therapists, coaches, mentors. A resilient person recognizes when they're going through something and they actually seek support. So it certainly isn't something that you need to tough out and do it yourself. A resilient person will go and seek help, and that's really lovely. I think in terms of definition, you've got the kind of adversity and navigation of that. So it's not a instant bounce back kind of thing. It's very more compassionate finding of your resources, and then you've got someone who seeks help, who actually gets the help and then grows through that journey. So I think that is a more compassionate way of thinking about it, because look, things happen not only in dentistry, but of course our personal life. If we think about the mental health continuum in a quite simplistic way, we know that it's dynamic, this continuum. We know we're shifting up and down that, and we know that where we sit on that continuum is actually dependent on what's going on in our lives. And so, as I was saying, when we've got these personal things going on or dentistry stuff, we might shift further down that continuum towards poorer mental health and well-being. Drawing upon protective factors will really help us to increase our ability to flourish, in dentistry, outside of dentistry. So it's really thinking about how can you draw upon those protective factors and be more proactive in that process.
Oh, that's great. Thank you very much. So I guess a lot of your training focuses on creating this compassionate, psychologically safe team. What are the foundations of this kind of culture, and how can dental hygienists and dental therapists lead the way, even without any formal sort of leadership role?
So if you're in a clinician role, you are a leader. So I would say that there's definitely an opportunity here for all of us in dentistry to create a culture which is kind and compassionate. So it's really about, treating others with respect. So the way you speak to your team members, and also kind of role modeling that compassionate side, as a leader as well, so that nurses and other team members can see this. And that makes a kind of big difference. there is kind of that aspect of it. But also I would say there are dental hygienists and therapists now that are in a principal role where they've bought a practice. And so obviously when you're then at that level of leadership, there is a lot that one can do. So for those that have a practice, are they able then to invest in, training for the team around well-being? I think that's quite important. And certainly from the mental health, wellness and dentistry framework, that showcases the importance of having training as a team as well. So training in kind of well-being and stress management, perhaps even having a well-being champion within the team that is trained in suicide awareness, mental health first aid. I'd go further and add positive psychology practices. Could you have that champion integrate some of these activities in the workplace? So you have, perhaps a week of exploring strengths and integrating those more, or gratitude, or whatever it might be, or mindfulness, or, creating certain initiatives to help their team kind of flourish. And that makes a big, big difference. In terms of culture, it's really set from the top. So you do what you can, whether you're a practice owner or if you're in a leadership role, with your nurse, your patient. But with the latter, of course, there's only certain things you can do in terms of the culture. You're going to try your best from your end to create a culture that's kind and compassionate, the way you approach things. But if you do find then you're in a practice where there is bullying and civility, it's really crucial as well to be aware of, look, you can't change those aspects. Is it about finding an environment that's better for you, that actually leans into your values? And I think that's quite crucial when we're talking about flourishing individually. So it's really trying to do that, and that's really difficult for, I think, younger clinicians, but also even some older clinicians really struggle with this. They might actually put up with these negative toxic traits because they feel like they should. It goes back to toughing it out. I should be able to manage this, or these aspects really play into it. But is there a way where we can pause and think about our own well-being and our performance, and could we find practices that align better with us? And I think that's a really important message, because certainly for the younger generation to feel, or any generation, that it's so crucial, your well-being. You can't outrun poor culture. It's not about meditating more. It just doesn't happen. And so even when we're talking about well-being in dentistry, the only way we really change things is when we get organizational change. Your practice has got that positive culture, you've got positive practices within the team, plus you've got that employee side of things. They come together, and that's where the magic happens. Sometimes we focus too much on the employee stuff and forget, well, actually, it's, like I said, it's like the bullying, the talking to each other in a harsh way, but also lack of resources, time pressures, all of these things, micro managing, leadership styles, all of these things can make a big kind of impact. And so, I think we need to be mindful of those aspects. It's the two that come together that are really kind of crucial.
Yes, absolutely. And to help each other as well, because sometimes I don't think people are aware that something is unacceptable until another person points it out. So we can look after each other within the team. That's great. Thank you. So if somebody in the profession is struggling right now and feels isolated and overwhelmed, what would you say to them? I mean, how could they take that first step to seek help or reconnect with support?
The first thing to say is, to really validate what they're going through. So, it's understandable that you might be experiencing, signs and symptoms of burnout. You might be struggling. It's very common. We know from the stats, it's incredibly high. So just to kind of honor that, look, yeah, you're going through something, and that we get that, like that happens to us at times. And then I would encourage that person then to seek support if they can. If you come across a colleague like this, or a friend or a loved one, I think it's really crucial we want to give advice straight away, look, go seek help. And they might not be in that position yet. So it might be initially just speaking with compassion and kindness and mindfully listening, really, and just working out what is going on. So it might be just really checking in with your friend, your peer, or your colleague. Is it okay if I can talk to you? I've just noticed that, perhaps you're feeling a bit down, or there's something not quite right. Like, can I please explore that with you? And being mindful as to how they approach it. So if they share with you, yeah, actually, I'm going through a tough time, you'll be able to gauge where they are at. And you can even ask, well, look, am I okay just to share some resources with you? And they might say no, and that's okay. But if they say yes, then you can then lead them to the many, many resources that dental professionals have. So you've got Confidential, which is a 24 hours helpline, which is a charity that's run by Dentists for Dentists, but also the wider team, which is great. You've got the Dentist Support Trust as well. So this is another charity that can help you around not only mental health, but financial problems and drug issues and things like this. And you've got the NHS Practitioners Health Support Trust, which allows you to go via the NHS to get 6 CBT sessions. So I need to actually find out whether that's still a thing in Scotland, though, but I think it is currently. But you've got this support. You've got different charities to help you. I know the BDA have got their own thing as well. So you've got a few dental specific things. You've also, of course, got the private route of going to see a therapist, or of course talking to your GP as well. And it might be that it might be good that you may be that there's a conversation around medication. It could be a conversation around therapy, or a combo of the two. But that's kind of the different steps. The only layer I would add to this is if you think your friend or loved one or peer is suicidal and has suicidal ideation, where they're actually planning suicide, then that's a different conversation, because it's very much about you trying to get them crisis support help. And of course, a lot of us are not able to do this. We're not in that position to know how to do this. But what I would suggest is you contacting perhaps one of these charities and getting the charity to reach out, and then they've got pathway to lead to crisis care, and that can be really quite useful, rather than feeling like, okay, well, I don't know what to do. I am really, really concerned about suicide, and there is a plan in motion that I think there is happening, because it might be that colleague has shared with you but doesn't quite want to take the next step at this point, but it's important to act out at that point where you can.
Yeah, and look after yourself, because that in itself would be a terribly stressful thing, wouldn't it? And I'm thinking of our own society, the BSDHT. I think there's so many member benefits that some people, because they've never needed to access them, wouldn't even be aware of, and that must be the same in every organisation. But also, some people are not members of a professional organisation. I think I always have been, but it sometimes confuses me. But then I don't know if everybody knows when they graduate what's out there for them and what it's there for. So that's a really good area to explore as well, isn't it? And see what already exists. Thank you. So Mind Ninjas workshops, they blend positive psychology, mindfulness and behaviour change science. Are there any particular practices, you've mentioned many already, but are there any particular ones that you think have really landed with dental teams and sparked lasting change?
I think what would be quite useful actually would be to delve into then a framework known as PEMAH. And this is a positive psychology framework, which is really nice in terms of drawing upon pillars and ingredients that we might be missing in terms of our own well-being. So this framework is very much about how do we increase your well-being, your engagement at work and happiness. And it's evidence-based. So it means that it's been explored in terms of the research around different organizations, from like schools to organizations and armies and things like this. So there's a lot of data on it. And essentially it's about drawing upon those different pillars. So how can we increase So the P stands for positive emotions. How can we increase our diet of positive emotions? E is around engagement. So how do we increase our sense of engagement at work? And that's through doing activities that get us into flow states. Flow states are states that feel really good for our brain. Athletes call it getting in the zone. And there might be activities within dentistry that bring you in flow states. Could you do more of them? Is there a way that you can craft your workday to do more of that? And perhaps you really enjoy composite bonding or short term also, or whitening, or certain elements of work. Could you integrate more of that into the workplace? Could you craft your day to incorporate more of that? And then outside of the workplace, what are your key strengths and how can you draw upon those more? So, is it perhaps you've got a love of learning? Could you book onto a course and explore that? Do you love creativity? Is that one of your key strengths? How can you integrate that more? And it doesn't have to be just in terms of painting or artwork. It's just thinking outside of the box and doing something different. So it could even be perhaps you just really love creating videos and you've got a side hustle. There's so many ways you can draw upon creativity, even in the workplace. When we're thinking about our strengths, how can we draw upon that more? So our empathy, that could be a key strength. How can we use that more with our patients, or how can we draw upon that during challenging times or difficult conversations to help us get through sometimes challenging aspects? So that could be a way of incorporating the E aspect. R is positive relationships. So this can be quite difficult in the workplace because we're all quite busy and sometimes we're isolated in our rooms, aren't we? But what we know from the data is even these micro moments of connection with our peers, with our staff members, even our patients, actually increase our positive emotions. They do quite a lot for us. So is there a way you can, perhaps prioritize little pockets? Perhaps the patient hasn't turned up, or maybe it's lunchtime, or whatever it might be, little moments in the day where you can catch up with your team members and there's a bit of banter and a bit of conversation and connection there. And then obviously outside the workplace, how can you be a bit more mindful and intentional in terms of developing your relationships further? So it might be kind of reaching out to a friend that you've not spoken to for a while and checking in, or it could be like organising an event with them or lunch or whatever it might be. So that's the R. M is about creating meaningful activities and adding more meaningful activities in the workplace. Meaning is such a big aspect when it comes to our well-being, and also interestingly burnout prevention as well. We need that sense of meaning, and one key way of actually getting meaning is through really aligning with our values. And so when our values don't align, burnout often can happen. That's one route to burnout. And so, is there a way, certainly as a practice owner, have you had a conversation around the values around the practice? Are the team members really familiar with that? Is there a way that you can bring everyone together to explore that? Sometimes there's even a values post that's put up on a practice. And then you're just reminded of the bigger picture and the bigger perspective. And then even helping yourself individually think about your values and why you're here as a dental professional, because as we know, there's so much negativity at times or so much stress. It's nice to be reminded of that bigger picture, that bigger perspective, and brings us a lot more purpose in our everyday clinical work. And then you've got A for accomplishment, which is about creating goals that align with your values. So is there a way you can do this even on a team setting? Is there a way that we can do this more? And then lastly, H is really around healthy habits. So how do we incorporate this in the workplace? Well, it might be, like I said, like having opportunities of practicing mindfulness. It could be going for that walk more, or even having boundaries, but thinking of ways we can kind of embed even like healthy foods into the workplace at lunchtime. Is there a way we can do this? Could we have a water fountain? Could we make the practice more ergonomic? have natural light in, all of these elements can really help in terms of us feeling good. So yeah, that could be a good kind of framework to think about, because it might be, when we look at those different ingredients, thinking about what are we missing currently, because this will shift obviously from week to week and from season to season. Is there anything that I can double down more? So maybe I am missing positive emotions in the workplace. Can I, integrate more mindfulness or gratitude, or can I just, perhaps prioritize my connections in the workplace? That's going to also increase my positive emotions. It could be that, or it could be that you're kind of missing the strengths aspect and you're not really thinking about that element. Can I get into more flow states where I'm really absorbed in the work I do? And perhaps I can, it could be elements that you already are familiar with that you like doing in terms of treatments. Could you incorporate more of that? Maybe you can have an afternoon of that, or part of the day of that.
No, that's great. Thank you. It's all terribly helpful for everybody. So, I guess finally, as someone helping to shape the future of mental health within our profession, what gives you hope and what would you most love to see change over the next few years?
I think what gives me hope is that there is more understanding of the mental health continuum, that we all sit on it, and that mental health is a key, important aspect of us, feeling good, and having a sense of meaning, and is equally as important as physical health. That shift actually, I feel, really started during COVID. Prior to that in 2019, when I was having conversations, there was still a bit of pushback around, look, this work that you're talking about doesn't really impact me, because I would never be burnt out, or I'd never be depressed, or I'm just not that type of person. But actually, there's this greater awareness that we all sit on this continuum, that life happens, and that does impact our well-being. And I think that's really interesting. Another kind of interesting, hopeful thing from my perspective is an interest around performance, performing well, flourishing, and those positive markers. And that's something that I've been really trying to champion with my approach of using and drawing positive psychology, because it's so accessible. We're really talking about everyone. We're not talking about just crisis point stuff. We're talking about things that all of us want, essentially, which is the sense of meaning and happiness and flourishing and thriving, both at the individual and at the team level. And so that gives me a lot of joy, and hope that, things can move forward, and that there is a bit of optimism around that. And I see that over time, the conversations have changed more around, like I said, moving away from just a crisis to exploring preventative things and exploring those positive markers. So I'm particularly excited about that, and I'd love to see more of that. What I want to see going forward is a step up in terms of organizations, across the board, dental organizations, corporates, to really focus on the organizational level, not just the employee stuff, because often, or sometimes, this is a thing that I've noticed over the years, and I get invited to do one-off things, which is quite frustrating. What I'd love to see, so the one-off things that are targeted to just the employee side of things, but actually the data shows that, like I said, it's the two aspects that come together. Let's actually work on the underlying issues, in the workplace. If we address those, we actually manage a lot of we remove a lot of the well-being poor outcomes, actually. So I'm hopeful in the future that organisations really step up on that front, and just in the way that industries outside of healthcare are doing. They invest a lot of time in leadership training that has a wellness focus around, really working on their managers as well, so that their well-being is looked after and they're able to then better manage the team. And so that's my hope for dentistry in the future, that we, if we could, if there's a button I can accelerate that, I would be, I'm pressing it. But it's a conversation, and it's trying to get that point across. But I think that will make a big impact around the stats that we're seeing.
Thank you so much. And it's interesting what you say about people needing a purpose. I believe that to be true. And if practices actually work on their core values and share and build it with their team, everybody would have a purpose, wouldn't they? They'd have a common goal, which can only be a good thing. Well, thank you so much. I just wondered, I think, lastly, is there anything that you would want to add, and how do people find out more about what you do and how do they get help?
The only thing I was going to add was I think just leaning into that last question about hope. Over the last few years, I've been facilitating the NHS Resilience and Culture Programme. So there are a lot of us working this space. I feel like this is quite exciting to see a focus, as I was saying, of the organisational and the employee side of things coming together. And so with this programme, in the Midlands, I've been working with a cohort of dentists, hygienists and therapists, working on resilience skills with them throughout the year, but also having a programme for the trainers around the culture side and around the leadership side, and developing those positive practices within the team. And like I said, it's those coming together where you can see the magic, and we can see that from the data in terms of increased perceived performance, increased mental well-being. It's really nice to see some impact. So there are ways we can integrate this in a practical sense, and I think programs like this can make a big difference. And I hope, as I was saying earlier, like there's more uptake within other NHS deaneries, but also kind of beyond that, private organisations and practices kind of explore and invest around the management leadership side to make a big difference. And then lastly, yes, if you want to get in contact with me, that would be fab. So I am on Instagram. I'm mindninja.wellbeing. I've got a website as well, so mind-ninja.co.uk, and I've got a couple of dental wellbeing, dental specific resources. So I've got the Mind Flossing Toolkit, which is a deck of mindfulness self-compassion cards, and then I've also got a book called Resilience and Wellbeing for Dental Professionals that I published with Wiley a few years ago. So we've got a few resources that are specific, which is really nice. I feel like that's what's missing as well in this space. Like we need bespoke stuff, and so hopefully that is a useful resource for you and the team. So if you are a principal or you have a practice, maybe think about integrating these resources as part of like Christmas gifts or onboarding gifts, so that you can, like I said, support your team in terms of flourishing.
Well, thank you so much. And thank you for everything you've done so far as well. It'd be brilliant to watch what you do next.
Thank you so much.
Thank you
it's been
so much for your time.
speaking
it's been
with
a pleasure. This episode of Dental Health Matters is supported by TP, the UK's #1 brand for interdental brushes, who share our commitment to advancing education and promoting better oral health. We're grateful for their partnership in making this podcast possible. So Miranda, thank you so much for joining us for our podcast, Dental Health Matters. So I'd like to introduce you to our listeners and our viewers. You're the Head of Clinical Education at TP.
That's right, yeah, in TP UK.
Brilliant. So I think we should start with what's new in your world right now. So what has TP got in store for us this year?
Brand new. We have a brand new product, our TP Easy Fit. So this is our first conical interdental brush. We've always stuck with our cylindrical brushes, which is still gold standard. But conical brushes have come around from sort of a need where we've got patients that are low on compliance. So maybe they just don't like a normal interdental brush, or they struggle to get their head around the different sizes. The Easy Fit will sort of bridge that gap for them. So it covers a couple of different gap sizes, and it just gives that versatility within a patient's routine, hopefully. But hopefully patients might see it, or consumers might see it in the supermarket and think, you know what, I'll give that a try. I've used floss before, I've used picks before, but I think a brush might be better, that they may be able to pick up this. So it comes in 2 different sizes, small, medium, and then a medium large. And if you think about traditional brushes, so if dental hygiene therapists are listening, or any clinician, this starts from a red to a yellow, and this is a yellow to a purple. So it's kind of 3 sizes in one. And like I said, it's mainly aimed at those patients that have low compliance, that We just need to get them introduced to an interdental brush.
Oh, I can really see how they'll fit in. And actually, I'm thinking of low income as well.
Exactly, yeah, that they can't afford
we know
to buy.
ideally that they should maybe have 3 or 4 different sizes, but this is, the 2 could cover their whole mouth.
That's it, exactly. And it's those types of patients that we can reach in having 2 different sizes just simplifies everything, and like you said, cost effectiveness as well.
Great. And they're being launched at the beginning of the year?
Beginning of the year, yes.
Brilliant, that's really exciting, thank you.
It is exciting.
So you've obviously got a new product, but is there anything, any other launches or anything you particularly want to showcase later in the year that you would think people might not be aware of?
Yeah, so we have our practice relationship managers that cover different areas of the UK, and we've just launched our Fika and Learn. So Fika is the Swedish word for coffee break. We are a Swedish company after all, so we're looking back at our roots there. But Fika and Learn is for the clinical professionals in practice, that our practice relationship managers can go out and deliver CPD.
Ah, okay.
So rather than a lunch and learn, it's a Fika and Learn, and we can provide the staff with pastries, but then a learning opportunity as well, and deliver CPD, which, for busy clinicians, it's not always, trying to squeeze it into your busy schedules or in lunchtime, and it's 30 minutes per module, so it won't take up the full hour if you're lucky enough to get a full hour in practice. But short and sweet, 30-minute modules, which are all obviously based around oral health prevention, and the second module is based around sort of dealing with patients with dental anxiety or special requirements for different patients, and how you would possibly try and overcome them and reduce those barriers for patients.
Good, so very clinically orientated for them.
But it's aimed at the whole clinical team, front of house, dental nurses. It's not just pitched at dentists, dental therapists, hygienists, it's for the whole team. And, for a front of house staff to be able to recognise what dental anxiety may look like, may help them sort of ease within their day. Oh, the patient isn't upset with me, it's because they're anxious, or they're just acting in a particular way just to make things nicer for our patients when they enter the dental surgery.
Oh, that's great, thank you. So how will people find out about this?
Yeah, so you can definitely visit our website, which is tp.com. There's a list of our practice relationship managers and all their details to reach out and get in contact to book Fika and Learns as well. So that's how you find us.
Oh, that's great. And everyone should try and find out who their local contact
that would be great.
So I'm thinking about the whole year and where can our listeners and our viewers catch up with you at events and things like that?
Absolutely. So always at a BSDHT regional meeting. You can find us there. Yeah. We'll be at the dentistry show in May, where we'll be doing a big full launch of our new product, Easy Fit.
Great.
So everything will be purple and turquoise. That will be the theme. And we'll be at the OHC next year, the Oral Health Conference, and the British Society of Periodontology, which is our other big conferences that we go to. We do host webinars throughout the year as well. So again, you can find that on tp.com, and that is open to any dental professional, and that's globally as well. So it's not just within the UK. We obviously attend quite a lot of the dental groups events, which we run webinars with as well. And they're not just closed to those dental professionals that work with that dental group. Some are always open to the whole profession, which is great. And you can also find us on TikTok.
Oh, wow.
We now have a TikTok channel, which I'm part of, and we've got different dental influencers developing content for us. So there's always something going on social media as well.
Oh, I think we've got to go and find people where they are, haven't we?
Yeah, absolutely. And it's just reaching those new professions that are coming through. It's just trying to engage with them. And it's great at conferences and on online, on webinars. But, there's loads of people on social media, and there's a right way of doing it, which hopefully we've managed to crack.
No, that's brilliant. So, and thank you for your support of our organisation. We really value it. And to see you at the Oral Health Conference in November. It's on the 27th and 28th in 2026, and it's at ICC Wales.
So
in Newport, partnering up with you again.
Which is great.
Well, it's very close to me, so that's
that's perfect. Yeah,
not much travelling.
Did you pick it for a reason?
No, I didn't. No. Okay, well, I'm thinking now about myth busting.
Yeah.
There's often things, and I know you must hear it all the time, like rumours, things people chat about products and things that you make, and you think, oh, if only I had the chance to explain to them, that's not the truth, or that's not how it is. Yeah. If you had the opportunity to bust one myth, what would it be?
Why isn't toothbrushing enough? And as dental professionals, we know why toothbrushing isn't enough, but it's that general public, that patients that we see. Why isn't toothbrushing enough? Well, we know that toothbrushing just covers around 60% of the tooth surface. It's those in-between areas that toothbrushing just can't get to, no matter what type of toothbrush we use, whether it's a manual or electric, how brilliant your technique is, it doesn't quite matter. It's those in-between really tight spaces, which is where an interdental brush does come in, and in those tighter spaces use floss. So yeah, why isn't toothbrushing enough?
Yeah, no, that makes sense. And it's sort of what I see as a clinician every week, the same issue.
Yeah.
And I think when you can break it down
absolutely
to the basic level of, in order to have health, you have to clean every surface of every tooth every day.
Yep.
You can't do that with a
Do we want to go
toothbrush.
down the shower analogy of cleaning all the important bits?
Why not? Whatever it takes. That's what we're going to do.
But it is. It's just that breaking it down to patients so that they understand the need, and that 60% is only sort of toothbrushing, and it's that 40% that the interdental brush gets to, and it's just breaking it down, and they're like, oh, actually, that makes sense. And if we have to draw pictures or diagram, whatever it takes.
And we wouldn't be happy with anything else that was only 60% clean, like a plate in a restaurant or lipstick on our
cleaning your
cups.
car for 60%. No, so we want to obviously get to all surfaces.
Yeah, and you help us deliver that message to the patients as well.
Thank you.
Oh, well, thank you for your time today, Mahrukh.
Of course,
it's been great.
It's been lovely. Thank you.
You're welcome. We'd like to thank TP, the UK's #1 brand for interdental brushes, for their support of this episode. By partnering with BSDHT, they help us amplify the voices of dental hygienists and dental therapists and keep prevention and education at the heart of our profession.
Hello, it's Simone Rosario here, President-elect for the BSDHT. This episode's member question asks, they have been asked to extract a supernumerary tooth on a child. I have never been asked to do this before, and they couldn't find any guidance on it. And they wanted to know whether the tooth would be classed as a deciduous tooth, which is within our remit as dental therapists, or a permanent tooth, which isn't. They wanted to know if someone could give them some advice. Our response to that inquiry. Once again, we had sought out some advice from various colleagues within academia, so colleagues that are teaching dental therapists, and also colleagues within the oral maxillofacial surgery department. And here's the advice that they shared with us. Supernumerary teeth can be both deciduous and permanent. Supernumerary teeth are generally considered permanent. So it would be a no to the extraction if it is classed as a permanent tooth. The majority of supernumerary teeth for children are actually given an orthodontic assessment and advanced imaging like CBCT. The advice on CBCT is because you do not know what is going on under the gingiva. The tooth could be ankylosed or it could be resorbing the adjacent tooth. For adults who we cannot carry out extractions on permanent teeth, a full treatment plan would be warranted. Radiographic and clinical assessments is paramount here to determine the clinical features of the tooth that is deemed to be extracted. The clinician as well needs to be trained and competent in carrying out this treatment as per the GDC guidelines and within the scope of practice. We strongly encouraged the member to request a radiographic assessment to determine the features of the tooth and ensure that they are primary. We also suggested that they contacted their indemnifier and seek advice regarding supernumerary teeth on children. If you have a question for a future episode of Dental Health Matters, do get in touch at bsdht.org.uk/podcast.
That brings us to the end of today's episode of Dental Health Matters. Thank you so much for listening. I hope you found today's conversation helpful and informative. If you enjoyed this episode, please remember to subscribe, leave a review, or share it with someone who you know might benefit. See you next time.